Help Me Find a Doctor, a part of the Having a Baby in Hungary video course. Congratulations on your pregnancy. This is a wild and exciting time. So what now? Your first question is probably how to find a doctor to take care of you during the 9 months of your pregnancy. So where can you find a doctor who speaks your language? That's easy. In the ebook you received with this course, you'll find a list of English-speaking doctors and their contact information. There are even some other languages too, like German and Romanian. Look in Appendix A, B, and C. Generally speaking, you have 3 options when looking for a doctor. You can go to a public clinic, a doctor's office, or a private clinic. Which one is right for you will depend mainly on what kind of insurance you have and how much money you can afford to spend. On this slide, you see that there are many ways to combine the type of insurance with the type of service provider. These are the 2 factors you need to decide when considering your prenatal care options. What kind of insurance do you have? And where do you want to get your care? If you have no insurance and you just want to go to a public clinic anyway, your costs will be very different than if you have no insurance but you want to go to a private clinic. Let's look more closely at how much money you can expect to spend for each of these options. If you have no insurance, you can still get care, but you will need to pay cash. If you're poor, do not go to a private clinic. This may seem like the easiest option, but you'll be shocked by how much your first visit ends up being once they include the doctor's fee, the ultrasound fee, and all the lab fees. You can easily spend more than 200,000 forints for just one visit at these clinics. You can get the same tests done for a fraction of the cost if you go to a public clinic or to a doctor's office. If you have no insurance, but you do have a budget set aside for spending on your prenatal care, then go to a private clinic and ask about their package rates before you schedule your first appointment. You can get a package rate that includes all your 9 months of care for the price of just 2 or 3 visits. Your cheapest option is to go to a public clinic. Just make sure that you take someone who can translate for you, at least the first time around. Then, once you're there, find out if they have an English-speaking doctor who works there, and in the future, use that doctor. Hungarian public clinics are not terribly used to having to bill anyone ever, so be prepared for some confusion when it turns out you have no insurance and want to pay cash. They are still obligated to provide service, but they have to figure out how to handle payment. If you have the Hungarian public health insurance, also known as társadalombiztosítás or TB, you can theoretically get all your prenatal care for free. You can go to a public clinic and see the doctor on duty, then go to the public hospital and give birth with whoever is on duty when you arrive. This is completely free of charge. Most Hungarian women who can afford it will instead go to a doctor's office and choose to pay the 5,000 to 15,000 per visit fee for this service. Then they will go to the hospital where their doctor has privileges to work, and in this way all of their care is covered by their health insurance except for the doctor's fees. You may wonder what the difference is between seeing a doctor at a public clinic or in his or her private office. Basically, what you're paying for when you go to a doctor's private office is shorter wait times and a guarantee that this doctor will be there at your birth. If you go to the public clinic, you will see whoever is on duty, and when you give birth, you will give birth with whoever is on duty at the hospital. Hungarian public health insurance does not cover private clinics, but you can still go there if you can afford to pay out of pocket. Most clinics have a package rate that's significantly less than paying for each visit individually. If you have international private health insurance, the first thing you need to do before you visit any doctor is to call your insurance company and ask about your maternity benefits. Each insurance policy is different, so even if you have the same provider as someone else, your contract with the insurance company is what spells out the details of your coverage. Be sure to ask your insurance company if they have a list of providers in your area that they like to work with. With that said, most international health insurance companies will cover any of the options in Hungary, including the private clinics. Beware, the cost of birth is never included in the cost of prenatal care. Prenatal care only includes the medical care you receive during the 9 months of your pregnancy. The cost of birth will include the hospital fee and your doctor's fee for delivering the baby. Be sure to ask your doctor well in advance about the cost of birth, not just the cost of prenatal care. You have probably heard about this weird system in Hungary where even though medical care is free, patients are still expected to tip their doctors. These so-called tips often add up to more money than the doctor's official salary. This is a tricky subject that makes most patients and many doctors very uncomfortable. Technically, if you're seeing a doctor at a public clinic for free, they are not allowed to ask for money. Nonetheless, the expectation is often that you offer some money after services are provided. When in doubt, have the money ready in an envelope and offer it to the doctor as you're leaving. They will often refuse, but it doesn't hurt to come prepared. And even if your prenatal care was free, the doctor attending your birth will definitely expect some form of money after the birth, especially if you had the same doctor for your prenatal care. If you're going to a doctor's office, the prenatal visits will usually be paid to the receptionists, so you don't need to worry about tipping and envelopes. After the birth, though, you will still be expected to pay the birth fee in a gift or an envelope, even if there's no mention of payment at the reception. If you choose a private clinic, you don't have to worry about any of this. You can make this awkward experience a little bit more graceful if you come prepared with your money in a pretty envelope or hidden in a gift basket for after the birth. As you're considering your choices, keep in mind that usually doctors only work at one hospital. There are a few exceptions, so be sure to ask your doctor. This means that whenever you're choosing a doctor, you're also choosing a hospital. If you're early on in your pregnancy, birth may seem far away, and the choice of hospital may not seem terribly important. You should know that there are big differences between hospital policies, what's allowed and what's not allowed at each hospital. For example, some hospitals will not allow your husband to visit after the birth. Some may not allow you to eat or drink during labor. It is very important for you to visit your hospital and find out all the information that is important to you before you make your choice. Hospital policies can be so inflexible that you may want to consider choosing a hospital first and a doctor second. Take a look at the Help Me Choose a Hospital video in this course to learn more about the available hospitals. Home birth is another option if you're interested. You'll find the contact information for English-speaking home birth midwives in Appendix E of the Having a Baby in Hungary ebook. If you choose home birth, your midwife will provide some of your prenatal care, though you will still have to go see a doctor for lab tests and ultrasounds. Your midwife will attend your birth and take care of you and your baby after the birth, but you will need a backup obstetrician, a backup hospital, and a pediatrician for your baby. So even if you choose a home birth, you will still need doctors to provide some of your care. As for money, home birth is a very affordable option. A fee of about 150,000 Hungarian forints will include your 9 months of care, the delivery fee, and your postpartum care. But you should know that even though home birth is completely legal, it is not well accepted by the medical community. Other than money and logistics, the two most important questions you need to answer are where you want to give birth and with whom. Consider that birth physically works best in an environment of calm relaxation. That is when birth is most likely to happen without complications and without delays. Your state of mind can strongly influence the speed and safety of your birth. If you are scared or tense, your body will slow down labor and you will experience more pain. If you are relaxed and happy, your body will speed up labor and produce more pain relief. So consider carefully. Where would you feel most comfortable giving birth? Who are the people who would make you feel safe? Here are some questions to consider. There are no right or wrong answers here, only what works best for you. What makes you feel safer, a home-like environment or a clinical environment like a hospital? Do you think ancient wisdom or modern science knows best? Do you have definite ideas about what you want and do not want for your birth, or would you like your doctor to provide guidance and make decisions? Do you have specific requests such as epidural pain relief, birthing in a tub, elective cesarean, or completely natural birth? How many people would you like to invite to your birth? Do you want more or less testing and supervision? Spend some time thinking about your gut reactions to these questions. Then, find a doctor who supports your vision and preferences. If you're wondering how much all of this is going to cost you, there isn't a straight answer. If you have Hungarian public health insurance, you could do it for free if you don't mind giving birth with whoever's on duty at the public hospital. If you have international private insurance, again, you may not need to pay anything out of pocket, but you definitely need to check with your insurance company. Some of the private hospitals in Budapest are expensive enough so that some insurance companies refuse to cover them. Most expensive is if you're going to pay cash for everything and you choose a private clinic and a private hospital. Even here, though, there are enormous differences between your options. On the most expensive end, you could spend 20,000 euros, that's more than 6 million Hungarian forints, for your prenatal care and your birth. If you go between these two extremes, you should expect prenatal care plus the cost of birth to fall somewhere between 200,000 and 500,000 Hungarian forints. So, your simple question of how do I find a doctor is really not as simple as it first seems. You need to take into consideration many factors, such as what kind of insurance you have, how much money you can afford to spend, what kind of care would best suit your needs, where and how you eventually want to give birth, and last but not least, do you actually like and trust the person that you choose? A great way to gather more information is to ask others who are in the same position as you are. Many of the people on the Budapest Moms mailing list are either exactly where you are, pregnant and searching, or they very recently went through the same experience. If you copy the link shown on the slide, it will show you all the posts in the group that mention the word doctor. Browse through these answers or change the search word to suit your needs. Alternatively, you could come to any of the get-togethers or free mommy-baby groups organized by the Budapest Moms community to meet others and ask your questions. Budapest Moms is an inclusive group of women from all walks of life, from the wealthy expat wives to working single moms to missionaries to mixed nationality couples just passing through. Whoever you are, the community will be glad to have you. Good luck in your search. If you need more information, don't forget to watch the Help Me Choose a Hospital video or make an appointment with me to discuss your choices.